everyone, I wanted to hop on here and give you a couple of items in just a quick list of things that are really helpful for keeping your hygiene when you have a urinary catheter. You might find that just basic things like going to the restroom and showering are a little bit more challenged, and they are, but there are of course some things that can help with that and kind of maintain your hygiene. And of course, the main thing with a few of these products are to prevent a urinary tract infection, which is really how I even started this channel, was with UTIs and having a catheter at home, how to maintain your hygiene and make sure we are keeping that area very, very clean. So let's get started. So first thing I wanted to say is if you have or will be having a vesicovaginal fistula repair, which is a fistula removal surgery, you will have some vaginal bleeding, but also some urological urinary bleeding. So because of that, I kind of anticipated that I would be having some bleeding. So I picked up another little box of these thin pads. These are like a light pad. The cheapest ones you find are absolutely perfect. I would not wear tampons for that. I think that might be dangerous. Check with your doctor. I'm not a health professional, by the way. I just someone that has had a catheter twice in my life. So I would wear a thin pad and I would change that throughout the day. So you will anticipate light spotting. I am about 8 days now post-op. I'm not having but just barely a tinge of blood. But if you are, having continuous and heavy bleeding, definitely contact your doctor. Something is going on and we want to make sure you catch that. But moving on to just shower and hygiene tips. First thing I would love for you to have is a shower caddy. I don't know why I pulled this out of my shower, like you don't know what these look like, but a shower caddy. You might call these different things, but these are great. This is the cheapest one I think I found in my local dollar store. It was like $6 or something. But I hang my catheter like this. I don't want to show you, but I hang it like that in the shower. And that keeps the bag off of the shower floor, which of course there could be bacteria there no matter how clean you keep your shower. We don't want that on the floor. So being able to hang that. Now you can hang this on the shower head itself, like this is the shower head, or what I have to do, because the shower head is kind of arched in my shower, what I have to do is hang this on the actual water knob handle. I hang it there just while I'm in the shower and I move it for my husband later. But I really like that. And again, it's so easy to just pick that up and just have that off the floor. Super handy. While in the shower, I would recommend using Hibiclens. This is a foaming, kind of an antiseptic cleanser that you can not only buy, it's a little expensive, but the hospital gave me this. Both times I had my urinary catheter, they gave me this. This is a foaming, I'll just show you. It's like a foaming cleanser. It's actually really nice. It's unscented, and it is intended to reduce the bacteria on the surface of the skin. So I recommend using this every time you shower. You can use like a gentle cleanser. It would do the same thing, but particularly after you have had a bowel movement, I would recommend using this, washing your front area first and then the back area. This will reduce any potential bacteria that is still on the surface or outer area of the skin and hopefully reduce the potential of contracting a UTI. Another thing on that topic of visiting the restroom, if that makes you uncomfortable, I'm sorry, but this is kind of what we're talking about today. I would recommend flushable wipes. So make sure that your system, your plumbing system, septic system, whatever you might have, I would make sure first before you start flushing anything down there, make sure that you can have those. But these are really great because again, we want to maintain proper hygiene all the time with toileting. After a bowel movement, you want to wipe from the front back. You never want to bring that bacteria or any fecal matter potentially towards the front, towards the catheter, always away. I would use as many of these as you need to make sure you're good and clean. And what I do is I go right into the shower and wash with this. So again, we don't want fecal matter and bacteria on this outer surface of the skin if at all possible. I would try to reduce that. A few other things that I think are super helpful, and I talked about this briefly in my previous video, but I did not know this, but you can order those leg stabilizers for your catheter. I didn't know you could order them. You can. So if the hospital does not send you home with one, I would definitely order those. I saw them on Amazon for a 4-pack. I want to say for about $10 or $12. I'm not really sure. I shouldn't, I feel like as a patient, you shouldn't have to go and buy those things, but it is actually very cool that you can. So, and if not, honestly, I would just message your doctor and say, can I go pick one of those up? Because that would help a lot. Again, the first time I had a catheter, I did not have that. And the catheter tube was just kind of dangling. Very uncomfortable, very uncomfortable. And I feel like you have a greater potential for that to get caught on things, particularly when you're getting dressed and undressed. Those catheter leg stabilizers, super, super helpful. Another thing I would recommend, and again, to each their own, but mainly because of the fact that I guess the beginning and end of all of this and why I'm even sitting here filming this video today is because I had chronic urinary tract infections for an entire year after my hysterectomy. So I had a total abdominal hysterectomy and with injury to the bladder. Lots of videos on that about a year ago if you want to go back on my channel and watch those. Kind of journaled that through video and what that's like to kind of wake up and go, oh, I'm going home with a catheter for 2 weeks. Wow, I didn't see that coming, So kind of journaled that there, but basically I started having UTIs, and I won't go into full detail on this, but I basically was having UTIs. It was every couple of weeks. It was just round the clock. I was always sick. And after going to my general doctor and then urgent care and just spending a lot of time and a lot of misery and a lot of money on that, I was sitting there with my doctor and I said, is there a department that specializes with this? Can I see an infection doctor? And he said, urology. I want to get you a urology referral. That's how this all started, and that's how the diagnostics were started and initiated to determine that I did have a vesicovaginal fistula, which was an abnormal communication between the bladder and the vagina. So I was passing small amounts of urine through my vagina. I was none the wiser that that's what was causing the UTIs. But basically, all that to say, that entire year that I was going through that, I was on prophylactic or low-dose antibiotics. Sorry, I feel like I have to sneeze. Low-dose antibiotics. So I was taking nitrofurantoin, 100 milligrams, 50 milligrams. They changed it a few times. But my doctor had me taking that once a day at about the same time every day. When I met with him before my surgery for my pre-op consultation, I asked him if I could take those right up until the surgery. And he said, yeah, actually don't discontinue those. Let's take that even the night before surgery. I want that in your system. And he shrugged. He goes, actually, if you want to, you don't have to, but because 1 in 10 catheter patients, not my research, that's actual urologist that quoted that here in Texas, but he said 1 in 10 catheter patients will contract a urinary tract infection at home. So if you want to continue antibiotics, I can call that in for you after your surgery, and you can continue those until we discontinue or remove the catheter. To which I fully agreed. I said, yes, please, because I feel like no matter what you do, and honestly, the first time I was doing everything. I've always practiced good hygiene, of course, but I didn't want to go through that again. It was miserable. So yeah, I would definitely, if you want to request low dose antibiotics while you are home with your catheter. Talk to your doctor if you're taking other medications where that may not be safe or necessary, by all means. But it's really good to go in informed and be prepared to ask those questions and not kind of find out the hard way like I did. So But basically, yeah, that is all I wanted to pass on to you guys. I hope that does help. I will think in my next video, I want to do like just showering, getting dressed, just tips too, just how to do that safely without tripping or hurting yourself or pulling your Foley tubing. But let me know down below what questions you have. If there's something that I could go over in better detail, I am absolutely happy to do so. I have a lot of time on my hands because I'm home from work for about 3 weeks. So let me know what else I can help you guys with, what questions you have, and I will be talking to you again very soon. Thank you so much. Bye.